was asking, is there hope? I mean, if you have healthcare workers unable to pay their bills, losing their lives because of this pandemic, is there hope for millions of Kenyans out there? Those are some of the questions you're trying to ask this evening. We're speaking to Dr. Jackie Kitulu, Kenya Medical Practitioners and Dentists Council Board Member. Ma'am, thank you so much for joining us on KTN Prime this evening. We're also speaking to Dr. Peter Kamunyo, Chief Executive Officer, NHIF. Lady and gentlemen, thank you so much for joining us on KTN Prime. Dr. Kamunyo, let me begin with you, and I'll ask the question that Rita just asked at the tail end of her story. Is there hope for millions of Kenyans out there, do you think?
Thank you very much, Linda, and good evening, viewers. Indeed, there is a lot of hope for Kenyans, and this hope has been progressive from even the time that NHIF was formed as a department under Ministry of Health 54 years ago. And progressively, we've been working towards ensuring that Kenyans have access to quality, affordable healthcare without financial hardship. And this is what the UHC and NHIF right now, being the vehicle taking us towards UHC, we stand for. So, as you look at currently having over 22.5 million Kenyans who are members of NHIF, and the people who've been benefiting all this time. For example, in the last financial year, we've had close to 10 million Kenyans who have accessed healthcare services through NHIF and gotten the care that they needed. And this is ongoing. And as the President the other day launched biometric registration for the indigents in support of those vulnerable and poor population who cannot afford access to care, and committed the first phase of 1 million households to be supported through NHIF, that which we are ongoing in terms of registration. There is indeed a lot of hope, and we hope that no Kenyan is left behind in our quest towards universal health coverage.
Doctor, it's interesting that you say that you hope no Kenyan will be left behind, and this is the question that comes to mind, and Kenyans have been asking this as well. So does it mean that these doctors who are really struggling with the bills in the hospitals, were not members of NHIF, were not remitting their contributions, is there a possible explanation to what's going on from where you said?
Yeah. First of all, Linda, allow me to convey my sincere condolences to the family and friends of the 32 fallen heroes. I'd call them heroes, as they are frontline workers during these times of COVID. In terms of access to care, a lot of the healthcare workers do have access to care, especially of the ones civil servants. And this program had started way back in 2012 when we launched the first cover for all civil servants that included both in and out patients. And that signified a transition also on NHIF, whereby we introduced outpatient cover. And from that time, and for the last 8 years, they've been enjoying that comprehensive cover, which is enhanced and includes frontline workers. And at the onset of COVID, you may recall that His Excellency, the President, also directed that we find and design a cover that would be able to protect the frontline covers.
Is that cover there, sir?
Yes, I'm happy to say that we have an enhanced Group Life, Group Personal Accident and Work Injury Benefits Act cover for civil servants and the National Youth Service that includes the frontline workers. And this enhanced cover is a major improvement from the previous cover that was there, because it also covers for COVID-19, and the benefits have been enhanced to up to 8 times the annual salary of the members, should there be the unfortunate occurrence of demise.
Okay, let me bring in Dr. Jackie Kitulu. Ms. Kitulu, so the NHIF CEO says there is hope, there is a medical cover, an enhanced one for that, for healthcare workers. What are your thoughts?
Thank you, Linda, and I'm delighted to be here to have this conversation, difficult as it may be. Now, is there hope? On the area of hope, I think there is hope. Because once we start on this journey of UHC, because it's a journey, we are not going to get there in a week or two or a year, but we need to start. And the initiatives that we have taken over are a sure hope that we shall get somewhere. The question you ask about the healthcare workers, there is a challenge. And for sure, we are now into December. The first case we had of COVID in this country was in March. To date, we have thousands of healthcare workers who have been exposed, who have been ill, who have been isolated at home, who have been in quarantine, and we have the 32 who have passed on in the line of duty. And my heart goes out to them. The cover for them has taken a while to establish. So you realize that with the devolution of healthcare, we have the national workers, we have those who are in county governments, and some of the counties may have taken an NHIF cover, others may have taken a private cover or otherwise. And as we talk of healthcare workers, let's remember that they're not just doctors, they're nurses, they're laboratory technologists, they're radiologists, there's a whole lot of them. So some are in the public sector, others are in the private sector. And sometimes when we have this conversation, we forget that they all serve Kenyans. There are no private or public Kenyans. Now, the healthcare workers in all these areas are highly exposed. So those who are not in the civil service, for one, do not enjoy such a cover. Their employers may be able to give some sort of cover, but not fully. In the public sector, there are those whose counties have taken a full NHIF cover, others have not. The enhanced cover that Dr. Kamunyo has mentioned is actually a new cover that has been enhanced to ensure that COVID-19 is covered. So in terms of the coverage, it is not universal, even to healthcare workers. And in this, I mean, as we approach UHC Day on Saturday, we are not yet there where we have a full coverage that adequately covers all these healthcare workers. And if it was, we would not be fundraising for them, we would not be hearing the sad stories of, that you've been reading in the media about healthcare workers serving people in hospitals and not being able to afford care in the same facilities in which they work. But it is a journey and we need to focus on it. And the reason we need to focus on it is that the human resources, an adequate, skilled and well-trained and motivated workforce is fundamental and pivotal to the delivery of UHC. So this whole workforce must be taken care of if we want to achieve the goal of UHC.
Okay. And there's a good point you brought in. Kakamega Governor Wycliffe Oparanya, who's also the chair of the Governor's Council, at some point held a meeting, and in that meeting they were working on modalities of working with NHIF to just try and see if the healthcare workers in their counties can get the medical cover. So that's one of the things that I want to find out from the NHIF CEO. How far did that conversation go, if at all? And the raft of other issues that we need to talk about in terms of affordable healthcare. And as Dr. Kitulu raised, there's UHC Day coming a couple of days from now. What have we achieved? If we are to take stock, what is there to celebrate, if at all? All right, so allow me to take a break. When you come back from this break, we'll have business news, and then sports news, and then now we can continue with this conversation because it's one that we absolutely must have.